Okay, so it's too windy outside to do a video outside right now. I can't, get good audio. But I wanted to do a video on a study that I found about autism. There's a lot of correlations between neurological illness, autoimmune illness, and gut bacteria, gut dysbiosis. And what I found was pretty interesting. It's definitely similar to what I found with epilepsy, where if you treat the gut issues, you tend to see better outcomes on the symptoms of those illnesses. So the case study that I came across is called Case Study Rapid Complete Recovery from an Autism Spectrum Disorder after treatment of Aspergillus with the antifungal drugs itraconazole and Spiranox. I might be butchering those names, but essentially meaning they diagnosed a child with an Aspergillus mold infection, specifically in their gut, and when they treated that, the child had their autism cured. And they don't there's not a whole lot of studies where they use that. They're using the phrase recovery, which is interesting. So the context of this in the abstract is a child with symptoms placing him within the autism spectrum and with urine biochemical markers consistent with fungal, Aspergillus colonization, of the gastrointestinal tract was first treated with the antifungal probiotic Saccharomyces boulardii. A dramatic Herxheimer reaction provided strong clinical indications that mold colonization might be a factor in causing autism in this child. So just a couple of things on the background of this study is that this child had autism. They must have been going through, trying to see if there was anything, any underlying causes as to what the, what's going wrong with the child. And they found that there was a mold infection in the gut. Aspergillus is a really common type of mold. Oftentimes you can see it, sometimes a mildewy basement will have that powdery white mold on the rafters. That would be a good example from what I've read, and I'm not an expert, of Aspergillus mold. That can also be penicillium mold. Stay away from mold. It's not good for you in general. So then they go on to say that in treating it, or figuring out if that really was the case, they treated the child with Saccharomyces boulardii, which is a really common type of probiotic. Anywhere that sells probiotics, a lot of times will have that strain of, it's actually not a bacteria, it's a fungus. It's a yeast. It's very similar to baker's yeast or brewer's yeast. So it's interesting because the child had a reaction. Herxheimer reaction is, a good example of a Herxheimer reaction is if you have parasites and you start treating that, the parasites dying off can cause a really bad reaction. So the person being treated might all of a sudden start getting really bad fevers, might feel a lot worse, and if you stop treating them, they seem to get better. And the reason for that is their body's not trying to fight off the dead parasites anymore. So a Herxheimer reaction means, essentially, you are treating the underlying disease, but the symptoms are getting worse because the body is trying to process the metabolites and, the dead parts of the bacteria, the virus, the parasite, or whatever. So because they got that Herxheimer reaction with Saccharomyces boulardii, which was killing off the Aspergillus, then they went on to treat the child more aggressively with the two drugs, itraconazole and Spiranox. Now, apparently it worked because going down to the results here, this study states the following. The child had a complete recovery from all symptoms of autism and in addition developed excellent academic, athletic, and musical skills. The recovery coincided with a marked reduction of urine markers of Aspergillus colonization. So they're saying that treating the Aspergillus infection, I don't want to say cured because I don't want to get in trouble, but the child didn't have autism after they were treated for the Aspergillus colonization. The conclusions go as follows. Escalation of the dose of itraconazole resulted in a complete loss of all symptoms of autism over the course of 3 months. This rapid complete reversal of autism is consistent with several articles proposing mold in general and Aspergillus specifically as a potential major cause of autism. So it's a really interesting study. I'm going to put the link to it in the description to the video so everyone else can read that. And from here, I'm going to just kind of speculate wildly on it. I'm not an expert. I'm not a health expert. I'm not even a very smart guy. So everything I'm going to say here is just my opinion. Talk to your doctor before you decide to do anything health-wise. So what's interesting about this to me is there is a lot of crossover between autism and epilepsy. If you've seen my other video on epilepsy, you know that gut bacteria plays a large role in neurological illnesses. Anytime you have someone who has a neurological illness and then you check their gut, it's usually very out of whack with what you would expect a normal gut composition to be. So that's pretty interesting to me. The comorbidity rate for autism and epilepsy is high, meaning if you have epilepsy, there's around a 30% chance of also having autism. If you have autism, there's a 30% chance that you might also have epilepsy. So that's really interesting. You know, it could be that the disruption of the epithelial cells, the gut lining, maybe people aren't absorbing the correct amounts of minerals or vitamins. I've seen a lot of cases in epilepsy studies where they show that magnesium is really low. And that's interesting to me because sometimes molds or bacteria, they might scavenge you know, those vitamins and minerals from the gut. And so even if you're taking those vitamins and minerals, you're eating well, all that stuff, it still might not be getting absorbed into the body. And I found that pretty interesting. Again, this is all just speculation, but I have taken a lot of different types of probiotics and things like that, and I can definitely say that in my own experience, I've noticed a correlation between gut health and seizures for me. But this is interesting because of, you know, this is autism spectrum disorder. Someone suggested to me recently that it was interesting that Aspergillus mold, well, the name Aspergillus sounds similar to Asperger's, which I haven't done any reading on. I'll probably do a video about that at some point too. But again, this is just my opinion, but I don't believe that autism is just being diagnosed more now. I think there is a genuine increase in autism, or the diagnosis of autism, maybe I should say. And, you know, what's changed over the last 30, 50 years? Processed foods, and not just processed foods in the sense of like, oh, this soda has a lot of color in it or things like that, but the way that foods are preserved. You know, if you buy bread at the store, it's much more shelf stable than bread used to be. So bread used to go bad and be visibly bad and people would throw it away, whereas nowadays, you know, bread has, you know, weeks-long shelf life, which is unusual. It might be giving molds, specifically Aspergillus, an opportunity to grow. You know, and if people are eating more of these processed grains and cereals, that could be playing a role in, you know, the emergence of more autism. There's more that I could say on this too, but I'm going to try and keep the video a little bit shorter just because I want the focus of this video to be this study in particular. And hopefully doctors would start looking for, you know, biological markers of a mold infection or an Aspergillus infection. But there's a lot of other interesting things like the gut biome in infants. There's a lot that goes into that. I'll do a video on that sometime. But, you know, people aren't doing things the way that they used to be done, you know, so it would be interesting to do gut analysis on animals in captivity versus animals in the wild. I think you'd see a pretty wide divergence there. And the same thing could be said with people. You know, being born in a hospital environment, it's very sterile there. So there's a lot of research to be done there. But that's about all I've got for this video. I think I've covered everything that I wanted to cover there. But watch for more videos. I've got a lot more coming up. Thank you.